Today, we celebrate the opening of an emergency behavioral health crisis walk-in center to serve our communities, Cumberland, Perry, and Dauphin counties.
It is great that our 3 counties are able to collaborate and move this project to fruition.
It'll be a 24-hour-a-day, 7-day-a-week behavioral health crisis unit. As we all know, the window of opportunity for someone that's reaching out for help doesn't fit in a 9-to-5 box.
The walk-in center will allow individuals to get immediate access to supports and services for their mental health or substance use needs.
And people will be met with immediate resources and treatment versus going into an emergency department where they could sit for hours or days. And they will be met with compassion, respect, and support.
We're excited to know that people will have somewhere to go and receive help at minute 1. We're also excited to know that our mobile teams will be expanded to include peer support to be able to help individuals who are experiencing a behavioral health crisis be able to have someone with them to support them who truly understands what it's like.
This is a much needed service as the need for mental health treatment is increasing.
We're here to be able to provide that level of connection, support, and access. We're trying to provide regional and multi-county solutions to the issues that exist that often have people only having an option of the front door of the emergency room or the prison. And we know as we start to build out those resources and make the connections that we're going to see a much healthier community that plays a role in the solution rather than pointing fingers at the problem.
We can't speak highly enough of our 911 friends, our law enforcement officers who have been such an incredible support through the project, as well as the Emergency Health Services Federation, the Department of Health, and the many, many nonprofit and service providers who have all stepped up to really partner with Connections to work collaboratively to best serve folks here in our community.
Having Connections available and providing better access to crisis care delivers a positive impact to individuals and communities.
We are so excited to be at the point of actually implementing the basic tenets of the SAMHSA published National Behavioral Health Crisis Response Guidelines. Those 3 simple principles, someone to call, someone to respond, and a safe place to go, are finally real and here.
This is the culmination of about 2 years worth of work, so we're extremely excited to see how the Behavioral Health Walk-in Center will change and improve service opportunities to help people here in central Pennsylvania.
We're hoping that this front door and the ability to gain access through Connections will alleviate the stigma associated with mental illness and continue a community-wide conversation about how we can better serve those individuals who are struggling with mental illness.
Together, we are stronger, and I know our work together will result in providing positive change in the lives of others.
Together, there's no limit to what we can achieve.